Hi, good evening. So, welcome back to yet another reading live session. This is me, Vandana PS, joining you from Neethu's Academy. So, let me check whether this video will be helpful for you guys, because in this video I'll be making, I'm gonna make doing part B. I mean a sample question from part B, as well as a self-prepared material for part A. Okay. So, as usual, I'll give you 2 minutes for the completion of the sample question from part B. Then we will discuss the answer. Okay, so ready? So, here comes the question. Hi. So welcome back. Good evening once again. Amy, Ezekiel, Nimi, Anu, good evening. So yes, have you all done this question? How was this question? എങ്ങനെ ഉണ്ടായിരുന്നു? So in this question or through this question, I'll show you how to do or what is the difference between and or. Okay, and I've told you once. I don't know whether you guys remember that. But I'll explain once again what is the difference between and or. And ഓറും തമ്മിലുള്ള ഡിഫറൻസ് എന്താണെന്നുള്ളത് I'll show you through this question. Okay. According to the notice, it is known to prevent viral infection. So this is a notice and my keywords prevent, then infection. Okay. Option A, it is known to prevent. So what is known to prevent? PG-IFN RBV may be used. So PG-IFN RBV, these are my keywords. And you can see one thing here. Here the first word is, it is separated with a comma. So comma is a word or is a thing that indicates what? Separation. Okay. Suppose I am saying you can take apple or orange. That means either നിങ്ങൾക്ക് apple എടുക്കാം അല്ലെങ്കിൽ orange എടുക്കാം. Either or. So separated ആണ്. It is separated. So here comma which indicates separation. Option B, Bossipriver can be used. So my keyword is Bossipriver and Sofosbuvir can be used. So these are the keywords from options. Alright. Then I'll read the paragraph. Treatment for HCV. Before the commencement of HCV treatment, it is necessary to genotype. The virus has different genotypes, require different types and duration of treatment and the protease inhibitors. Okay. Current therapy for genotype 1 infection is a combination of PG-IFN, RBV and a PI. So from this particular line, you can eliminate which option? I know that majority you got option A, right? No. Yeah, I know. Because very directly mentioned PG-IFN, RBV. That is why you guys selected option A, right? But it's not the answer. Why? Here, PG-IFN, RBV, it is separated. It's not a combination. But in the paragraph very clearly mentioned this is a combination therapy. ഏതൊക്കെയാണ് combinations? PG-IFN, RBV and a PI. So here RBV and a PI is a combination therapy. This one is separated with this. ഇത് രണ്ടും combo ആണ്. So PI is missing here, right? You can eliminate option A, opposite or contradictory. Then polymerase inhibitor, which results in high rates of sustained virological response. Then Bossipriver, Simiprevir and Tenofovir. So here, Bossipriver is separated with a comma. Kanda. It's already separated. So maybe option B. And one more reason, Bossipriver, what is a Bossipriver? Which means a protease inhibitor. ഇവിടെ പറയുന്നുണ്ട് second line le duration of treatment and the protease inhibitors that is using, okay, as a treatment option. So maybe option B ആയിരിക്കാം, maybe. Then dual therapy with PG-IFN and RBV. Again ഇവിടെ it is combined, it is a combination treatment. And എന്നാണ് പറയുന്നത്, and which indicates combination. Okay, apple and orange, which means you can take both. Okay, so that means here this is a combination PG-IFN and RBV. So it's here it is again separated and with a comma. So it's not option A, again eliminating option A. Or Sofosbuvir with RBV. Here with which means and എന്നുള്ള meaning ആണ്. With which means combination along with അതിൻ്റെ കൂടെ. എന്തിൻ്റെ കൂടെയാണ്? With what? Sofosbuvir with RBV. See? So this is again a combination. These two. Okay. So here only mentioned about this one. So again eliminating option C, contradictory. So what is the correct answer? Answer is option B, Bossipriver, which is known to prevent viral infection. That is the correct answer. Okay, so clear? Any doubts? Understood? I mean, what is the difference between and comma? And as always, it is showing combination and option, or is showing separation. Okay, that is the difference. So answer is option B. That is the correct answer. And only Amy and Sanila got the correct answer, right? Very good, very good. Okay, it was a little bit difficult question. Majority, I know, maybe you'll get option A. Okay, yeah. So that's all about that. Anyway, so now we are moving to the next one which is, we have another topic, a self-prepared material for part A, which is ventricular septal defects. Okay, simply we can say VSD. Alright, so today I'm gonna explain the questions, but before that, as you can see here in this screen, a new material, self-prepared material, ventricular septal defect. I'll read it, then I'll underline what are the keywords, then let's move to the questions, because I don't know whether you feel the same. 1 to 7 set of questions as well as 15 to 20 was little bit tricky. I don't know. Am I right? How was the material? Please tell me in the comment box. Material? How was the material? Was it very easy or an average material or difficult? How was the material? Yeah, how was the material? Yes, Jissa, how was it? The material? Easy or average material or a difficult material? Yeah, I think 1 to 7, it was tricky, as well as 15 to 20 also tricky. Average material, yes. It's not a very easy one, I can't say so. But not difficult, yes. An average material, yes. Average reading material, yes. Alright. So I'll read the paragraph so that you can listen to it and just underline the keywords. Okay. So a ventricular septal defect is a condition where you are born with a hole in the wall between the two layer chambers of your heart. Often shortened to VSD, this condition is most common congenital, meaning you have it when you are born. That is congenital. Heart defect and often happens alongside other types of heart problems or defects. A small VSD is usually minor and has a few or no symptoms. However, a larger hole may need to be repaired to avoid permanent damage and complications. Almost all VSDs are present at birth. A VSD diagnosis most likely happens during childhood, though adults can also receive a diagnosis. However, this only happens in 10% or less of cases. VSD is also slightly more likely to happen in premature babies and babies with certain genetic conditions. In very rare case, a heart attack can tear a hole between the ventricles and create a VSD, while this type of VSD is sometimes called ventricular septal rupture or VSR is technically a side effect. It is still a dangerous problem that needs to be repaired. VSD happens in about 1% of all newborns. However, VSD diagnosis in adults is much less likely because the defect closes on its own during childhood in 90% of cases. VSDs that are side effect of the heart attack are extremely rare, especially because of modern heart attack treatment methods. Today, it happens in less than 1% of all heart attacks. So, these are my keywords from the text. Okay. So, ningalde keywords idakku thanne aano. So, now text B. So, what about text A? So, what is a summary? Text A is all about what is VSD and what are the causes, then what about the prevalence. Okay, adana parayunna. Text B. Then clinical assessment. Okay, so what about clinical assessment? A physician can diagnose VSD especially when they are moderate or large sized based on a combination of symptoms, a physical exam and imaging test. A minor VSD may go undetected when the hole is too small to cause signs or symptoms. A physical exam is one of the most common ways of a doctor to discover VSD. That is because a VSD, when it's large enough, causes a sound called a heart murmur that your doctor can hear when listening to your heart with a stethoscope. It's even possible to estimate the size of the defect from the sound of a murmur. Other tests that help diagnose VSD include the following imaging tests. So what are they? Echocardiogram, that is the first method, right? This test sends ultra high frequency sound waves through high frequency sound waves through your body from a device held against the skin of your chest. The sound waves create a picture of the inside and outside of the heart. Depending on the size of the VSD and its exact location, it's likely to be visible on an echocardiogram. This test is also painless and only takes minutes to complete. Time indicating words, yes. Then electrocardiogram, second one, ECG or EKG. So when if any questions related to this, you can write ECG or you can write EKG because abbreviation is directly mentioned here. This test uses multiple sensors attached to the skin of your chest to detect the electrical activity of your heart. The activity appears as a wave of on a printout or a digital display for a healthcare provider to review and interpret. Over time, your heart structure can change because of VSD. When the structure changes, the electrical pattern also changes. However, this test will often be normal if the VSD is not large enough or if the heart has not started to change shape. Then the next one, chest or heart X-ray. When the VSD is large enough, it will cause the structure of your heart to change. That the change is visible on certain types of chest or heart X-rays. In some cases, it also involves injecting a substance into the blood, and that is easily visible on X-rays, which allows healthcare providers to see any unusual. Okay, blood circulation that indicates VSD or other problem. Then computer tomography or CT scan. This test uses computer to process X-ray images into a three-dimensional picture of the inside of the heart. Like with the chest or heart X-ray, an injectable substance that is highly visible on CT scan may help. Cardiac catheterization. This procedure uses a catheter device to look at the heart from the inside. A specialist inserts the device into major blood vessel, usually one near your upper thigh, and then passes it to your heart. Once inside your heart, it can help pinpoint the size and location of any problems like a VSD. The most likely reason to use this test when a healthcare provider suspect blood vessel damage in the lungs. Then text to see VSD complications, the problems: respiratory infections, congestive heart failure, infective endocarditis, failure to thrive, pulmonary hypertension, then Eisenmenger syndrome. So these are the complications. And text today it's all about the treatments. So what are the treatments? Two main ways to repair VSD are surgery. The most reliable close a VSD is to patch it surgically. To do this, a cardiac or a heart surgeon will operate and patch or close the hole. Depending on the size and location of the hole, it may be as simple as stitching the hole shut. In other cases, it might involve a patch made of synthetic material or a graft of your own tissue. Then transcatheter procedures like cardiac catheterization. These procedures use a transcatheter or catheter-based approach to access heart via a major artery. Once the catheter device reaches the defect, it can place a specialized device called an occluder and plug hole. Then these devices are typically made of a mesh framework covered in synthetic material. Medications. So what are the medications for the condition? Diuretics. Okay, these medications increase the amount of fluid your kidney remove from your body. This is helpful when fluid is built up around your heart, a common effect of heart failure. These medications may make you urinate or more often. Okay, heart failure medication. So these are the medications. These medication can help the control the strength and timing of your heartbeats. As example, digoxin, a common medication in the treatment of heart failure that is also helpful for VSD. Okay, so these are my keywords from each of the text. Okay, clear? So that's that. See, a lot of markings. So definitely I'm very sure these keywords which I'm already underlined will definitely gonna help me to find out my answers. Let's see. Okay, so from text A, what are my keywords? Text B, what are the keywords? C, what are the keywords? And D. Okay, so let's see how these keywords or how my keywords will help me to find out the answers. Alright, so moving to the first set of questions, which is 1 to 7. And what about part A? What do you guys know about part A? It's been a long time. We had discussed about part A, right? So please let me know in the comment box. What do you know about part A? നിങ്ങൾക്ക് എന്തറിയാം? പാർട്ട് എനെ പറ്റി എന്തൊക്കെ കാര്യങ്ങൾ അറിയാം? ഒന്ന് കമൻറ്റ് ചെയ്തേ. Hi Karthik, how to get this material for practice, ma'am? Actually, dear, we are uploading, we upload every day the material in this official page called Neethu's Academy Reading. Okay, so we have a page called Neethu's Academy Reading, and in that page, daily we will upload the material. So before I think 11 a.m. so that you can take the material, take the printout of the material, then you can do the material. Clear? Yes. Yeah, so Amy, starting with the time, right? Yeah. So I'll just summarize about part 8 today. So please do listen properly. Okay, you careful to listen to ya. Then definitely if you guys are following this method, you can score what? 20 out of 20 in part A. Okay, so we have 20 questions in part A, right? 20 questions. Yes. What about the time? Etra minute aanu? Actually, reading exam is 1 hour. 60-minute exam aanu. Okay. And out of this 1 hour or 60 minutes, you can take 15 minutes for the completion of part A. Alle? Yes. Hi, Midun. Good evening. 15 minutes for the completion of part A. And what about the number of questions? Already I've told you, 20 questions in total. There's 20 questions they have divided into 3 different sections. 3 different sessions aitana ivaru divide cheyidikkunnathu. The first one, 1 to 7 set of questions, that is called match the following questions. So what is it? Endana match the following question? So match the following question, which means you can read the question, underline the keywords from the question, then just imagine, okay, in which text the answer is from, in which text these keywords are from, എവിടെ നിന്നാണ് ഈ കീവേഡ്സ് കിട്ടിയത്, എവിടെയാണ് ഈ കീവേഡ്സ് മെൻഷൻ ചെയ്തേക്കുന്നത്. That will be the answer. So that you can write there, either if it is from text A, you can mark A. If it is from text B, you can mark B. So likewise, just please do mark which text. Okay. Then, next set, it is 8 to 14, that is short answer questions. As the name indicates, even, see, lot of doubts regarding short answer questions, and I think it is a difficult area for the students in part A. എനിക്ക് തോന്നുന്നു almost all students, yeah, they will cover 1 to 7 set of questions very easily. They will do 15 to 20 set of questions very easily. But they are stuck in what? 8 to 15 set, 14 set of questions. Why? എന്താണ് അവിടെ പോകുമ്പോൾ stuck ആവുന്നത്? Because they have no idea how to answer it properly. See, just imagine short answer questions. We need short answers there. Okay, you can write it in a word or a short phrase, maximum 2 to 3 words, not more than that. Definitely they will strike it off if you guys are writing more than 3 words. Remember. Okay, so short answer questions. And in short answer questions, you can expect questions like what? Maybe the question will start with what? When? Why? How? Which? Where? Okay, as well as maybe the question will be in the starting of a sentence. Sentence in the starting il chalva question vera, or maybe the question will be in the middle of the sentence, middle question vera, or it can appear in the ending of the sentence, avasanam vera. Okay, so whatever it is, answer will be very short answers. And if the question is starting with when or where, if the question is starting with when or where, there should consist, or that particular answer should consist what? എന്ത് കണ്ടെയ്ൻ ചെയ്യണം, എന്ത് വേണം അതിനകത്ത്? ഇറ്റ് ഷുഡ് കണ്ടെയ്ൻ ഓർ ഇറ്റ് ഷുഡ് കൺസിസ്റ്റ് വാട്ട്? എ പ്രപ്പോസിഷൻ. ഓക്കെ, എവിടെയാണ്, വേർ ഇറ്റ് ഹസ്, എങ്ങനെയാണ്, വെൻ, സോറി എപ്പോഴാണ്, വെൻ. ഓക്കെ, സോ ദാറ്റ്സ് ദാറ്റ്. ദെൻ ലാസ്റ്റ് സെറ്റ് ഓഫ് ക്വസ്റ്റ്യൻ, ഇറ്റ് ഇസ് 15 to 20, which can be called fill in the blanks. So very simple, as the name indicates, you can fill the blanks. Okay, and coming back to part A. And to complete this 20 questions within 15 minutes, we need a strategy. So if anybody is doubtful about the strategy, please do listen properly. We need a strategy. We need a method. Otherwise, you can't complete part A within 15 minutes. It will be difficult for you, for sure. Okay, so please do complete part A within 15 minutes. If you want to do so, you should do this. You should follow this method. What method? That's called skimming and scanning. And I know for sure you have heard about skimming and scanning through a lot of videos, but you have no idea what is skimming and scanning. That's the truth, right? Yes. So what is skimming and scanning? And I'm very sure those who are attending the live sessions every day, definitely you guys know what is skimming and scanning. Skimming and scanning. So what is skimming and scanning? Please do comment. Please let me know what is skimming and scanning. Please let me know in the comment box what is skimming and scanning. Yes, what is skimming and scanning? Please let me know what is skimming. എന്താ skimming എന്ന് പറഞ്ഞാൽ? What is skimming? Yes, very good, Jissa. Yes, Amy, fast reading or speed reading. Okay, so what I've done here, which was a average reading. ഞാൻ വായിച്ചത് ഭയങ്കര ഫാസ്റ്റ് ആണെന്ന് ഞാൻ പറയില്ല ഒരിക്കലും, because that's my average reading. Okay, so fast reading, which means majority of the portions will be in your mind. It will be circulating in your mind, and the rest of it is articulating through your tongue. Okay, പകുതിയും നമ്മുടെ മൈൻഡിലായിരിക്കും, ബാക്കിയാണ് നമ്മൾ വായിക്കുന്നത്. That's called fast reading. And if you want to fast read something, it's not a very easy procedure. ഒരു പെട്ടെന്നൊരു ദിവസം വായിക്കാൻ പറ്റുന്നതല്ല ഫാസ്റ്റ് റീഡിങ്. ഇറ്റ് ഈസ് എന്താണ് സ്ലോ പ്രോഗ്രഷൻ. ഓക്കെ, ഒരുപാട് ടൈം എടുത്ത് പ്രോഗ്രസീവ് ആവുന്ന ഒരു ടെക്നിക്കാണ്. സോ പ്ലീസ് ഡു ഫോളോ റീഡിങ് ഹാബിറ്റ് എവറി ഡേ. പ്ലീസ് ഡു ഹാവ് എ റീഡിങ് ഹാബിറ്റ് എവറി ഡേ. ഓക്കെ, സോ പ്ലീസ് ഡു ഇൻകൾക്കേറ്റ് എ റീഡിങ് ഹാബിറ്റ് എവറി ഡേ. ദാറ്റ് ഈസ് ഇമ്പോർട്ടൻറ്റ്. ഓക്കെ, ഇപ്പം നിങ്ങൾ വിചാരിക്കും ഇതൊക്കെ എന്ത് ബുദ്ധിമുട്ടാണ്. ദെൻ വാട്ട് ഈസ് റീഡിങ്? എന്താണ് റീഡിങ്? വാട്ട് ഈസ് റീഡിങ്? റീഡിങ് വിച്ച് മീൻസ് വി ആർ അണ്ടർസ്റ്റാൻഡിങ് സർട്ടൻ തിങ്സ്. വി ആർ ഡൂയിങ് സർട്ടൻ തിങ്സ് വിത്തിൻ എ ലിമിറ്റഡ് സെറ്റ് ഓഫ് ടൈം, എ പീരിയഡ് ഓഫ് ടൈം. Okay, so if you want to do so, please do, okay, follow whatever instructions I'm giving you, right? Okay, like reading, make a reading habit. Yes, so coming back to this strategy, then what is scanning? Skimming, ningal paranju, fast reading, yes, Jissa. Yeah, so what is scanning? Yes, hi Shiny, good evening. Fast reading, looking for keywords, that is called scanning. Alle, looking for the important words from the text. നമ്മൾ വായിക്കുമ്പോൾ, as you can see here, I've underlined a lot of words here. Why? Not sentences actually, words are. Okay, so why? Because I think, according to my knowledge, I know that these are the important words from the para. Okay, എനിക്ക് അറിയാം ഇതൊക്കെയാണ് important words. How I know that? എനിക്ക് എങ്ങനെ അറിയാം? Because we have another strategy for that. എന്തൊക്കെയാണ്? You can underline all the headings. എല്ലാ ഹെഡിങ്സും അണ്ടർലൈൻ ചെയ്യാം. Please do underline all the headings. Second, underline all the subheadings, subtitles. Underline all the numbers. All numbers underline there. Definitely there will be questions including numbers. Fourth one, signs and symbols, not symptoms, symbols. Okay, fifth one, all the names. Again, they will ask you a lot of questions. Who done this? Aara cheythathu. The surgery was done by this person. Aara. Okay. So, name of everyone, maybe name of a person, name of a disease condition, name of a procedure, a country, whatever names they have mentioned, please do mark all the nouns. Okay. Sixth one, abbreviations, short forms, VSD, ventricular septal defect, VSD. Ventricular septal rupture, VSR. Definitely there will be questions regarding abbreviations. Seventh one, brackets. Okay. Please do mark all the brackets. Eighth one. So what is eighth one? Italicized or bold words. And I found there is no italicized words here, but we have bold words here. Kanda, echocardiogram, clinical assessment, electrocardiogram. So these are the bold words. Then the words which indicate time. In short answer questions, definitely they will ask you questions which start with when. Okay, when it happened, when it was introduced. Okay, so likewise, when you have to deal with such kind of questions, you should be, very careful about what are the words which indicate time. So please do underline the words which indicate time. After 1970, in 2020. So likewise, the word should be there. Then the next one, the words which indicate experiment related words. What is the name of the procedure? Which procedure have done there? So, like, experiment related words will be there. Procedure, diagnosis, administration, absorption, clinical, observation. Okay, identification, ascertain. So, experiment related words. Then, the words which indicate research related words. Research, researcher, study, aspect, population, category. Okay, strategy. Likewise, the words which indicate research. Then, the first and last line of each and every paragraph, definitely I can say majority of the questions will be from the first and last line of each and every paragraph, as well as you can underline all the bullet points. Clear? Okay, so that's all about the strategy. Okay, so in this strategy, you can underline the keywords from each of the text. I hope it is clear for you. If any doubts, please do comment it. Any doubts? Yeah, already you guys know that, right? Yes, Jissa, very good. Heading, subheading, numbers, italic words, bold letters, abbreviations, all brackets. Yes. Iniyundu, kata. Yes, Amy, subheadings, numbers, brackets, signs and symbols, abbreviations, italics, bold words. Yes, yes. Okay, okay. So that's that. Anyway, coming to question answers. Ini namukku nokam, how can we answer the questions, okay? First one, the accustomed system to ascertain VCD. Okay, so here we have, some words which are not familiar to you. Ninka athra familiar to words aano? Accustomed. Okay, system, ascertain. And ascertain from my word, from my side, you guys know that means diagnose, അല്ലെങ്കിൽ identify. Okay, detects, identify എന്നൊക്കെയുള്ളൊരു meaning ആണ്, and you guys know that. So what is accustomed, which means yes, Jissa? Yes, Amy, what is accustomed? Yes, Shiji, Megha. എന്താണ് accustomed? I am accustomed to it. What is it? Accustomed. Okay, habitual, usual എന്നൊക്കെ പറയുന്ന ഒരു meaning ആണ്. So here, usual. System. So system here, which means a method, a procedure. നമുക്ക് method എന്നുള്ള meaning എടുക്കാം. Okay. So simply I can read it like the usual method to ascertain VCD. So what is the usual method to find out this condition? Where is it mentioned? This is not a short answer question, so very easy. Yeah, where is it mentioned? Is it mentioned in text A, B, C or D? എവിടെയാണ് മെൻഷൻ ചെയ്തേക്കുന്നത്? Please do comment your answers. Yes. Where is it mentioned? എവിടെയാണ് മെൻഷൻ ചെയ്തേക്കുന്നത്? The usual method to find out, ascertain VCD. Where is it mentioned? Is it mentioned anywhere? No. Mention ചെയ്തിട്ടില്ല? What is your answer? Please do comment your answer, please. Where is it mentioned? Yes, Jissa, very good dear. Yeah. Okay, so that is mentioned in text B. Why text B? Clinical assessment. How to find out, how to diagnose this condition. A physician can diagnose VCD especially when they are moderate or large sized based on a combination of symptoms, a physical exam and imaging test. Okay, so the diagnosis of the condition mentioned in B. Answer is B. Yes, Shiny, Shiji, Amy, Jissa, very good. Second one, the rationale behind CHF. Rationale behind CHF. What is the full form of CHF? എന്താണ് CHF എന്ന് പറഞ്ഞാൽ? I think congestive heart failure. അല്ലേ? That's called CHF, yes. And CHF is mentioned in, I think, I've seen somewhere here. Yes, congestive heart failure. Okay, due to volume overload. So where is it mentioned, the second question? It is mentioned in text C. What was the question? Reason behind CHF. So what is the reason behind CHF? Because it is one of the complication of the condition. So answer is in text C. Okay, yes. Okay, Amy, yes. Hi, Dhanalakshmi, text C. Very good dear. Third one, how about the proportion of chances for VSD to occur? So proportion, chances, occur. And it was a very easy question, not a very tough one. Very simple. Proportions mentioned in the second para of text A. അല്ലേ എന്തൊക്കെയാണ്? 10%, 1%, 90%. Okay, so that is mentioned in text A. Yes, very good, Megha. Yes, Jissa, Alina, Amy. Yeah, text A. Then fourth one, the direction of which condition is analogous to the management of heart attack. So direction, analogous, management. Yeah. Yes, Shiji, Dhanalakshmi, Nimmi, Sanila, Megha. Very good. What about fourth one? Direction. This is direction alla. It's not a way. Okay, it's not that direction. പിന്നെ എന്താ ഇവിടെ ഉദ്ദേശിക്കുന്നത്? Here, direction of which condition? Here, which means the management. Okay, management എന്നുള്ള meaning ആണ് here, which means direction, which means the management. Okay, synonym of which condition is analogous to the management. So analogous here, which means similar, same. Okay, similar to the management of heart attack. Yeah, ഏത് management ആണ്? ഏതാണ്? Where is it mentioned? Fourth one. The direction of which condition is similar to the management of heart attack. Where is it mentioned? Fourth one. ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? I think this was tricky. I don't know. Yeah. Is it in text A? No. Not in text A. Text B. It is management അല്ല, അത് clinical assessment ആണ്. Text C, of course, not text D. Text C is all about complications, nothing mentioned about management. Treatments, yes. So what is a similar treatment, or where is it mentioned? This condition, the management of which condition is similar to the management of heart attack. Where is it mentioned? Let me know in the comment box. ആണോ? D തന്നെ ആണോ? Is it text D? Is it text D? See the last line, heart failure medications. So what is it? These medications help control the strength and timing of your heartbeats. An example is digoxin, a common medication in treatment of heart failure that is also helpful for VSD. ശരിയല്ലേ? Answer is D. Only Megha got the correct answer. Very good, Megha. Okay. Fifth one, who has the least potential to get affected by VSD? So least potential affected, yes. Fifth one, so affected എന്ന് പറയുമ്പോൾ that means the prevalence. Okay, affection എവിടെ കൊടുത്തിരിക്കുന്നത്? I mean affected, the condition is mentioned, prevalence of the condition is mentioned in text A. So without even reading, I think you can get. Okay, only 1% for all newborns, right? Okay, text A. Sixth one, the best surgical intervention to manage VSD. Again, surgical intervention management ആണ് text D. See, kanda. So if you know already what are the keywords, where are the keywords, definitely you can underline and you can find out the answer. So answer is in text D. Seventh one, yes. Fifth one, yes. Nimmi, Megha, Jissa, Shiji, Amy, text A. Sixth one is text D. Seventh one, when does VSD remain? Take no notice of. All right. Let me know in the comment box what is your answer for seventh question. When does VSD remain? Take no notice of. Where is it mentioned? What is the meaning of the question? When does VSD remain? Take no notice of. Okay, Megha, it's D, right? Why D? Why it is text D? Actually, text D, I can say it's all about treatment, right? Management അല്ലേ പറയുന്നത് text D. It's not text D. VSD remain, take no notice of. Actually, this is a phrase. Okay, take no notice. ഇതൊരു phrase ആണ്. And it can be used with off. Off ആയിട്ട് നമ്മൾ യൂസ് ചെയ്യുക. Take no notice of. അതിൻ്റെ മീനിങ് എന്താ? What is the meaning of the phrase? Any idea? A ആണോ Amy? Take no notice, which means the meaning is disregard. Okay, so simply I can read it like, when does VSD remain disregard? That is the answer. Yes. Where is it mentioned? ഇനി ഒന്ന് ആലോചിച്ചിട്ട് പറഞ്ഞേ. When does VSD remain disregard? Regarded, which means considered. Disregarded, which means avoided, not considered. Yeah, it's not closed എന്നല്ല, disregarded എന്നാണ്. Okay, avoided എന്നുള്ള മീനിങ് ആണ്, not considered. And that is mentioned in ഏത് ടെക്സ്റ്റില്ല? It is not considered, it is disregarded. Okay, you choose A first, right? No, answer is mentioned in text B. Okay, it is mentioned in text B. So why it is disregarded? Why it is disregarded? എന്തുകൊണ്ടാണ് ഡിസ്റിഗാർഡ് ചെയ്യുന്നത്? സോ പ്ലീസ് ഡു റീഡ് ടെക്സ്റ്റ് ബി. ഇറ്റ് ഈസ് ഇൻ ടെക്സ്റ്റ് ബി. അതൊന്ന് കണ്ടുപിടിക്കും കേട്ടോ. വൈ ടേക്ക് നോ നോട്ടീസ് ഓഫ് വിച്ച് മീൻസ് ഞാൻ അതിൻ്റെ മീനിങ് പറഞ്ഞു, ഡിസ്റിഗാർഡ് ആണ്, അവോയ്ഡ് ചെയ്യുക, നോട്ട് കൺസിഡേർഡ്. ആൻഡ് ദ ആൻസർ ഇസ് ബി. പ്ലീസ് ഡു ഫൈൻഡ് ഇറ്റ് ഔട്ട്. ഓക്കെ, ആൻഡ് I'll ask you tomorrow. So please do find it out why it is in text B. Clear? Okay. So that's that. Anyone with 7? No. I think maybe 5 or 4, right? Okay. So next set of question. Short answer questions. Enhanced level of which factor in larger VSD leads to pulmonary hypertension? So enhanced. Okay, Alina, you got 7 out of 7. Very good, dear. So you don't have to find out, right? Okay, Nimmi, oh my god, 7 out of 7. Very good, very good. Okay, enhanced factor, then pulmonary hypertension. So these are the keywords. Which factor kanda? Question is in the middle of the sentence. Which factor? Either factor ana. Which factor is mentioned? Factor is mentioned in. Okay, Jissa, pretty good. 6 in പറയുന്നത് it's okay. Yeah, Anu. Next time, 7 out of 7. Okay, so yeah. So what about 8th one? Enhanced level of which factor? Okay, increased blood flow. ആണോ? Is it increased blood flow? Increased എന്ന് പറയുമ്പോൾ enhanced അല്ലേ? You don't have to repeat the same. അപ്പോൾ ഏതായിരിക്കും? Yeah, 8th one. Actually, it is in text C. Very good, Alina. Your answer is correct. Answer is pulmonary blood flow, because you can write there pulmonary blood flow because it is a condition. Pulmonary hypertension എന്ന് പറയുന്നത് it is actually a condition. Name on a name of a disease condition or a name of a complication. Pulmonary hypertension. And you can't separate names. So that you can write pulmonary blood flow. That is the correct answer. Okay, only Alina got the correct answer. Anu also. Yes, Anu, very good. Okay, yes, Vipina, sorry. Yes, Vipina, very good. 9th one. A drug that could benefit both VSD. Yes, Jissa, very good, dear. VSD patients and patients with heart failure. So, a drug. What is the name of the drug? Benefits. Yeah, already we have done this with this question, right? Remember? നമ്മൾ കണ്ടതായിരുന്നു. ഐ തിങ്ക് ഇറ്റ് ഈസ് ഇൻ ടെക്സ്റ്റ് ഡി. യാ, ഡിഗോക്സിൻ അല്ലേ? യെസ്, ഡിസ, പൾമോണറി ബ്ലഡ് ഫ്ലോ. വെരി ഗുഡ്, ഡിയർ. യെസ്, മേഘ, ഡിഗോക്സിൻ ഇസ് ദ മെഡിസിൻ. DIGOXIN, ഡിഗോക്സിൻ. ഓക്കെ. 10th one. Common respiratory infections that could be noticed in patients with VSD. Respiratory infections noticed. Yeah. So infections എന്നാണ് പറയുന്നത്. സോ പ്ലൂറൽ. വി നീഡ് മോർ ദാൻ വൺ. ഒന്നല്ല, ഒന്നിൽ കൂടുതൽ. യെസ്, വിപിന, എയ്മി, അനു, നിമ്മി, അലീന. ഡിഗോക്സിൻ ഇസ് ദി ആൻസർ. ഓക്കെ, അലീന, ബ്രോങ്കൈറ്റിസ്. ഞാൻ പറഞ്ഞു ഇൻഫെക്ഷൻസ് പ്ലൂറൽ. സോ മോർ ദാൻ വൺ. ഓൾസോ ഓൺലി ബ്രോങ്കൈറ്റിസ്. അത് മാത്രമായിരിക്കുമോ? Only bronchitis? Anything else? Any other infection mentioned there? Yeah, very good, Jissa. It is bronchitis and pneumonia. Okay, so when you write pneumonia, please be careful about the spelling. Okay, PNEUMONI. Answer is mentioned in text C. So complications are. So what are the complications mentioned? Bronchitis and pneumonia. Respiratory infections. Kanda. That is the answer. Okay, രണ്ടും എഴുതണം. ബ്രോങ്കൈറ്റിസ് ആൻഡ് ന്യൂമോണിയ. ദാറ്റ് ഇസ് ദ കറക്റ്റ് ആൻസർ. ബിക്കോസ് ഇൻഫെക്ഷൻസ് അല്ലേ ഇവർ ചോദിക്കുന്നത്. സോ യു ഷുഡ് റൈറ്റ് ദാറ്റ്. 11th one. Who are mostly eligible to perform surgery to manage VSD? So who? ആരാണ്? Who? Eligible. Surgery. So surgery is mentioned. I know it's in text today because my keyword surgery. Who is eligible to do the surgery here? ആരാണ്? It's a cardiac surgeon. Or you can write, see, ഒന്നില്ലെങ്കിൽ നിങ്ങൾക്ക് എന്ത് എഴുതാം? Either you can write A1, cardiac 2, surgeon 3. Or you can write A, heart surgeon. Okay, so either write a cardiac surgeon or you can write a heart surgeon. Don't write a cardiac bracket heart surgeon, that's wrong because 4 words. So either a cardiac surgeon or you can write a heart surgeon. Okay, yes. Then 12th one, the probability of maximum cases of VSD. Yes, Amy, correct answer. Yes, Nimi, correct answer. Yes, Alina, make a randu edanda, only one. Probability of maximum cases of VSD in adult population. Yes, number of cases are probability, possibility, proportion. Etrayana? 10th one, sorry, 12th one. 90 ano? Is it 90? Probability of maximum cases of VSD in adult population is a question. Yeah. Where is 90 mentioned? Why it is 90, guys? I know it's from text A. Your answer is correct. Okay, from text A. Yeah. But it's on during childhood, it is 90. So it's not 90. It is in childhood, right? So adult cases, how it is 90? See, what is the question here? Adult cases, adult population, but 90 which is indicating childhood, 90 cases, 90%. So answer is 10%, see. Okay, adults can also be receive this diagnosis, however, this only happens, or this and the number of cases of adults, right? No, so that is 10% or less of cases, that is 10%, not 90. Okay, 10% and it's not 10 എന്നല്ല 10%. Okay, our percentage in the symbol undallo, where is that? So 10% should be there, otherwise your answer is wrong. 13th one, a kind of VSD that has been considered as a dangerous percussion of a heart attack. So kind, a type aanu choikkunna, dangerous heart attack. Yes. What is dangerous? And I have marked it very clearly in text A. Okay, but evideyo njan adu mark cheyidittundairunnu. Yes, dangerous one ennu paranjittu. Here, kando, dangerous. See? Okay, so and that one is sometimes called ventricular septal rupture, or you can write VSR. Abbreviation is there. So no, nothing necessary here. You have to write the complete, this full form. You can write either the abbreviation VSR. Both are correct. Yes. Then, what kind of, same pattern, resonance might act as an indicator to detect larger VSR during physical examination? Yes. Another one, which kind of resonance might act as an indicator to detect larger VSR during physical examination? Again, physical examination, I've marked, I guess. Yes. Where is it mentioned? Is it heart attack? Physical examination samayathu heart attack aano? No, it's not heart attack, it's not stethoscope. See, they're asking a kind, a type aanu. So what is it? No, it's not stethoscope. It is the device they are using, right? Because the question is a kind, a type. Very good. Yes, Nimmi, it is heart murmur. Okay, heart murmur is the answer. Where is it mentioned? It is mentioned in first paragraph, yeah. So here, a physical exam is one of the most common ways of a doctor to discover a VSD. That's because a VSD, when it is large enough, causes a sound called a heart murmur. So answer is A, heart murmur. Okay, that is the correct answer. Question is not about what device they are using for that. Okay, answer is stethoscope. They are asking a kind. What is there? It is a heart murmur. So answer is a heart murmur. 15th one. Dash is obliging when pericardial effusion, a common consequence of heart failure. Yes. What is the correct answer? Obliging pericardial effusion. So pericardial effusion, the word is not mentioned in the para, I know. Because when I underline the keywords, I haven't seen anything related to, not related to the word pericardial effusion. Okay. Yeah. So what is the correct answer here? 15th one. What is the missing word here? Instead of, I'll tell you a clue. Or a clue, Pericardial effusion, which means what? What is pericardial effusion? എന്താണ് ഈ pericardial effusion എന്ന് പറഞ്ഞാൽ? Fluid build up around your heart. ഹാർട്ടിൻ്റെ ചുറ്റും ഫ്ലൂയിഡ് ബിൽഡപ്പ് വരുന്നതിനാണ് നമ്മൾ എന്ത് പറയുക? പെരികാർഡിയൽ എഫ്യൂഷൻ. ഓക്കെ, സോ അല്ലെങ്കിൽ വേർ ദ മെൻഷൻ അബൌട്ട് ഡാഷ് ഇസ് ഒബ്ലൈജിങ്, വിച്ച് മീൻസ് ഹെൽപ്പിംഗ്. ഓക്കെ, ഫ്ലൂയിഡ് ബിൽഡപ്പ് in the heart or around the heart, a common consequence of heart failure. So what is the missing word there? അതിന് എന്താ പറയുന്നത്? What is the technique called? അല്ലെങ്കിൽ എന്താണ് അവിടെ യൂസ് ചെയ്യുന്നത്? It is, I think it is mentioned here, yeah, diuretics. Okay, so where is it mentioned? Kanda, this is helpful, obliging when the fluid build up around your heart, that is pericardial effusion, a common effect of heart failure. So answer is diuretics. 16th one, dash employs numerous sensors secured to the skin of your chest to identify the electrical activity of your heart. Yeah, so what about 16th one? Dash employs which means uses numerous sensors, which means multiple, yeah, secured to the skin of your chest to identify the electrical activity of your heart. Yes, so what is it? And the use in for diagnosis, right? So either you can write electrocardiogram or you can write the abbreviation ECG or EKG. Both are correct. Don't write, electrocardiogram, ECG or EKG. You can either write electrocardiogram or you can write ECG or you can write EKG. Okay, yeah, ECG. Yes, very good. That's it. This test uses multiple sensors attached to the skin of your chest to detect the electrical activity of your heart. That is the correct answer. Alright, 17th one. VSD detection in adults is much less likely because defect closes on its own during childhood in dash of cases. What of cases? I think there needs a number. Yes. So you guys know that childhood ആണെങ്കിൽ എത്രയായിരുന്നു? Adult it was 10%. Childhood, your answer. അല്ലേ, നിങ്ങൾ തെറ്റിച്ചായിരുന്നല്ലോ. It was 90%. Remember, text A, കണ്ടോ? Childhood 90% of cases. So answer is 90%. 18th one, dash is usually done when a healthcare provider suspects blood vessel damage in the lungs. A very direct question. Healthcare provider, blood vessel damage. Yes. What about 18th one? Hi Tankasuda, good evening, how are you? So what about 18th one, guys? I think it is cardiac catheterization, right? Yes. Okay. So the most likely reason to use this test is when healthcare provider suspects blood vessel damage in the lung. So what method? Cardiac catheterization. That is the correct answer. And 19th one. VSD is the most common dash heart defect. Often happens alongside other types of heart problems or defects. Okay, so a very simple one, which is a congenital heart disease. Okay, so answer is congenital. And the last one, VSD may trigger bacterial infection in the endocardium, results in dash. Results in what? Last question, yes. Yes, Vibina, Amy, Alina, Dhanalakshmi, Megha, Anu, yes, Sudha, congenital. What about question number 20? Yes, Disa? 20 എന്താണ്? An infection they are asking about. So, infective endocarditis is the answer. Ano? Okay, bacterial infection of endocardium. So, answer is infective endocarditis. That is that. Okay, and I hope this session was helpful. So, that's it. See you tomorrow. Stay tuned.